as a short one, just to keep it bland and haven't got into focus. So unfortunately, I'm being assessed joint United Kingdom Tasmania as a disabled lady. Complexity needs, can't help that. And it's trying to recover. My mates have been cleaning our kitchen and they just got a bucket out and they just cleared, just trying to do what they can in here just to keep it. You can't do anything much to this because they won't repair this every year. Found all the other old reports ever since I ended up in a wheelchair, 2010, all the other OT housing needs reports all these years. And last OT report 2010, no matter what assessments I get offered, no matter what housing needs assessment and such I'll get offered, this National Housing Company employees just want me out of this flat. So, I'm a secure tenure. So what is the remedy to offer me the loss of secure tenure in statute on housing law? Landlord and Tenant Act 1989 and 1980, something I can't remember the other year, but section 11, and there's clear the duty of care is on this National UK Social Housing Company. But everybody in my area, everybody, are not being discriminated, are not victimised, are not harassed. I am. In my particular area, by clear, non-experienced individuals I've dealt with before I got so ill, again, like last year, and again recently. So none of my own family members in my area are giving monkeys I'm living like this. No. They're meant to be a certain religion, a certain Christians. No disrespect to all Christians, it's just the ones they are part of. I haven't done nothing to them, And I thought a certain individual, she gets a misconceived disinformation and turns into a major crisis and panics. And that causes me major alarm. And what happens next? Nobody consults me and asks me nothing. I am not a child, I'm an adult with coherent when I'm not so bloody ill. So just, this is a state I'm left to live like. My mates have to empty the bucket, and of their buckets they wash me into that main lane. There's a temporary wood flooring somebody's put down here since last July 2017, and all the time, all these emails and letters, I've offered a place that would meet my needs last year, where I could be with my care, physical care, personal care, equipment needs, transport needs, and they will offer me, funding to put my stuff safely in storage. I sought clarification how they would in advance pay for that and choice of my company I would like to use. Just put myself in storage while they claimed. There's no evidence yet. It's just opinion by a man on a letter. No proof. Why would a company, National UK Housing Company employees, block one copy, at least one, of housing repair report? So I know what's required, not a meeting. I'm so ill with all that, can't cope with all that. So I could send a copy, logically, to the current public servants who are trying to assess me, well, they won't question it, by the way, into what's known as UK Housing Convention Statute Law, Care Act 2014, implemented 2015, and they're meant to do it properly, and they're not. They rushed everything. We had no time, we had no accessible format, nothing. It's all the bloody cutbacks. And now comments by a certain one is, oh, where's all the OT reports? Don't they go to NHS or your doctor to chase them up themselves? Why come to the disabled individual and say we can't find update OT reports? Yeah, I've got them coming up my bloody ears. All that I went through, and still there is nothing accessible in my area anywhere now in the UK for disabled people to move into. Right? So the comment was again, can I contact your housing officer? I don't have one. Nobody does around here. This company works on the internet. Everybody logs in online. They're self-employed. So you could get anyone. The ones I've dealt with, the key ones I made clear for head injury, to no consent to deal with certain individuals. And what did she do yesterday? Certain individual, she ignores all that. So what's the point in having a care assessment when they don't bloody honour your choices and outcomes and key lawful due process in that care assessment statute law? Why also the fact that every bloody time I'm saying that all these emails, I've done the bloody hard work to hold people accountable. I went every single bloody where. Statute law, shelter, Citizens of Ice, all these so-called people meant to help disabled people don't give a shite in my area. Well, not for me anyway. Because, have a little word to somebody. I'm connected to such and such, so don't help her. That's what's been going on. I've got the evidence, proof, first-hand knowledge, every damn thing. So, I'd offered a solution, again, before I got injured, of a head injury, to a hotel around the corner, get a blinking OT out, and get me a hospital loan bed, like a medical loan bed, put it in the hotel room, and get my aides in there. I could be in there around the corner for 4 or 5 weeks, so they do gut out all this wet room, yeah? And the housing, conjunction with the so-called adult care or the NHS, whoever they would need to pull their funding budget together, could fund even for the first 8 weeks, not respite, what they call it, starting Olympus care. Yeah? Instead of my friends will change. That would be a solution, because the duty of care is Home Group Limited, United Kingdom, Housing Association statute law is known online as well. They're the ones that breach a clause in the statute law tenancy, Landlord and Tenant Act, and there's I think you call it Section 11, and there's also the Equality Act, Section 2010, Section 22, 21, are majorly disadvantaged. How many others are there in UK like me? Majorly disadvantaged. This is what it's like for disabled people in the United Kingdom. I'm not giving up, by the way. I offered, it was recent again, in that email, in no account did my mate say any word to say, you don't need to go to a meeting yesterday when I just come out of bloody hospital with a concussion. And then I'll get to that meeting struggling like hell yesterday, really dizzy and sick in my wheelchair. And then that woman turns around and says, you didn't need to come. What? And it was hard to bite my tongue, I tell you that now. And then she's then eventually, I don't know even why people bloody turn the major up in a cafe. You can imagine every bit of noise, you got concussion, it's just really, you're just not coping, you need peace and quiet. And I told her that, and I need to go. And my mate put it in an email. There was evidence. I said, look, you won't come here to my home, because if they come here, my home social worker, right, how it works, or the care advocate, see the reality I'm living like, all this time, so I'm getting so ill all the time because of all this, and the rest of my flat. How can anybody, it's like I'm camping out in here, and I'm paying for all this, by the way, in rent, and yet they won't even pay a bloody thing, and they put it onto me. How can I cause all this damage? It's caused by the leak of that non-correct fixture of the level access shower. That's concrete there. That's wood. And I said, well, find me somewhere else to live. Right. So this time I'm thinking about getting older. So I said, okay, you find me assisted living then. Housing with care on site. Yeah? Sheltered type, whatever it might be now, the model. I know that about. My late mother, bless her heart, had that kind of environment. But I'm 2 years young. I miss out on 2 years in the criteria. And there's quite a few places like that. So I've been getting my mind around this idea. Well, let me just, if you want me out of this is general needs, by the way, in statute law UK. If you get the right package of care, this is how it's working now, the cutbacks. If you get the right package of care, if one does, you might be able to live independently in a flat like this, but there's no way this housing company will give in. They don't want to fork out for the negligence and personal injury and compensation that I've suffered for so long, and let alone the evidence of me getting ill. But I'm too ill to sue their arse off because of everything else going on. So this is why they deliberately, unlawfully, by the way, using the expense of the public funds, the public pays their taxes for the public services. That's wasted because this home group limited company employees won't do their bloody job in the geo-care. In contract law, they're breaching contract. So the reason that Paul got ill again was notice of intent to take to court once and for all, and got all the paperwork ready to go. Gave them the last 5 days notice to come back, and I've used in-house complaints procedure, stage 2, don't get me started, how the lack of housing. There isn't any remedy for disabled people in the United Kingdom in a situation like this, because they will use statute law, health, what's it called? Adult safeguarding. If you don't know what adult safeguarding, just Google it and look it up, and you'll find in UK section 42, the Care Act, 2014, every private funded company, so whether it's private funded or NHS or county council, borough councils, whatever it might be, has a duty. So that means nobody, and I mean not one individual in their duty of care, will be bothered about all this. They just want you out and bundled up into what's known to be now, it's clear, is not a nice care home or safe choice of housing that's meant to be in statute law, because they just want to push. There's nobody in my area now. I know one lady, she's not treated like this. I think it's because her mum knows people. That's what it's about. If you know people, you might get what you need if your face fits, so to speak. Yet her flat is new built and it's open planned. There's a building opposite me around the corner. But these, I don't know whether the policy of this housing company is trying to get people who's less in part health. I know other people that were 3 people retired here in the area. One has got other unseen disabilities and he's not being bothered like this. But I'm ended up with complex ill health because of all this, and I'm the one to have to move out. And if I don't seem to be working with them, they will try and take me to bloody court. I haven't breached no tenancy, no contract, nothing. Done nothing. And they've done it to me. So that's what it is. So be it. We don't live in an ideal world. I'd just like to live somewhere away from here, actually, and do it day. But I'm not going to be bloody well pushed into another bloody flat where it's going to be more. This is centralised, but I need to be somewhere that's got I already stated what I require to key public servants out there, and it's meant to be in their computer system as an outcome in housing needs. It's not being done properly. This individual is rushing all these questions and is not given the disability law, disability rights. Check it out on their websites and links. It tells you that you can read it up, watch videos, what your rights are if you're a disabled individual yourself or family members in UK, what your lawful rights are, and it's being abused in my area and a lot of people in my situation too. So I'm trying to cut my losses. You would have thought if someone's so ill, wouldn't you offer a home visit? The thing is, they don't like offering a home visit. I'll tell you why. That public building opposite me. And that social worker sets foot in my home. She have to do a safeguarding referral. And that means there's no funding for a placement for people in my position, high complex needs, in an environment you don't even know where you're going to go. And that's why she's not offering home visits. And I bloody can't cope getting out and about. Do they give monkeys? No. Do I get the right offer of a GMC, General Medical Council member, doctor, on my medical, is it called medical practice, NHS funded GP practice? No. I'll just get pushed an individual I don't consent to. I already required that to be amended in someone I believe that female might be better understand my needs as evidence-based. I'm going around in circles with that one. So why should I then struggle with that bloody meeting yesterday? They know the situation, but yet, again, a care advocate says, oh, this is going to, next week it's going to be the last. Hold on, I can't bloody sit in my wheelchair more than a bloody hour now. Don't they get that? So how am I going to cope with the offer? This is deliberately done to me yesterday when I'm so ill. 3 hour bloody, 2 o'clock to 5 o'clock? But my mates has to recheck the note that was written. There's no way I can cope with sitting in my wheelchair for longer than an hour in a meeting. And the severe triggers with the physical and the psychological effect on my health, it's really not great. And they know that. And oh my goodness me. This individual, the old individual carer, we should call it care advocate, they got rid of her because I built up trust with her. She knew she's clued up on the stuff, and they conveniently got rid of her and appointed some young woman, no disrespect to the lady, but she has no idea about me. She doesn't read her notes. She hasn't read up the notes about the factual evidence on me. And if you do a subject access requirement, that takes forever. So I ain't got time for all that. So my sister, whatever she said, meant well in her own way, but she don't realise she hasn't seen all this. She's seen blinking pictures for a long time. She's in Wales and she's frustrated. She can't do nothing. She's offered me to move there a long time ago. So why don't she gone and bloody help me to get down Wales then? To a specialist type place that might beat my knees down there, which she said this months ago. And she ain't doing nothing. And then my mum ends up passing away. On top. So she's got her own problems now. And trying to cope. And I don't blame her what she thought she was doing. But the panic it caused everybody in this area. And then on to me. And they said to me, oh, it's implied that I had to get to a meeting yesterday. I can't really cope with that no more. There's no way. They're setting the date. I'm having to change it. Why? You see, they do it on the end of the week instead of in the middle of the week. So I've got a weekend to ponder about all their bloody stuff. Hold on. You can't expect complexity of disabled people living like this as well and everything else going on to cope with everything all in one meeting. No. It was said to me be broken down in blocks. That was not factual. One meeting and then the next meeting not broken down in blocks. Like to cope with one thing at a time. No. They haven't done it right. And that is by this individual female. She's just, her word is an advocate, but it's her management she works for, her manager. She's in this area and I should be going somehow. My mate will help me do that. Get an email out to the CEO, the overall manager of the service a national company is, and make it clear that they have breached their duty of care to me. Right? They should stick to offer me adequate service and break it down in chunks, like in time blocks. Not push it all in one. There's no way I'm in that position. And then I said, where is the offer of independent support for people that are vulnerable adults, right, in the UK, who are going through a lot. I said it's a lot for anyone. And then expect to meet people on their own in situations. No, it's impossible. So ages ago, it was all led to believe I would get advocacy help with meetings with house employees. I would get advocacy support, female support for this, that and the other, and use generic. Why aren't they gone to services in my area I know about housing needs support? These public servants are behind a lot, and they don't care that people like me are left like this. So I can't even make this up. This is a bigger picture than just me. Nationally, the statute law happening in the UK for disabled people left like this is to get them into, I don't know what they're called, but I know they're nationally run care establishments, like institution environments, where it appears they have choice and control, but you don't, right? They want people that, unfortunately, it's no fault of their own, they get ill or they're left like this. It was deliberately left to this area not to be repaired. So I'll be pushed in the hands of the public purse, and it's called, as I said, adult health social care. The wording, generalising, everyone's different in their personal situation. So if my family members gave a shite, weren't they been around before to say, oh my goodness, I've got a brother-in-law who's a plumber. He could have got his mates or his church friends to help me get this safe for me. Over a year now, he ain't bothered to contact me. And that's my own bloody sister for you, my other one. And what about my elder brother, who is also in my area, who's retired? Weren't he ages ago last summer seeing videos about this online? And weren't he offered to get his contacts in this church, if they're so Christian-natured, to help me look at getting a second-hand cooker, even if I could save up, I don't know if that was possible, to disconnect me over and get one in. To help me. The Christian people in my family, no, they're not. They're not. I hate to say that because they've not once treated me as a not member of their certain religion. No respect, each to your own, but you do not target me. Nobody ever gets away with targeting me unlawfully and making up non-factual things and then going to my family and then using my sister, God forbid. And then when you get to hospital, please don't get me started. You don't get no blinking OT equipment, medical equipment and proper care. No. It's too much to go into. And when you don't get a blinking public servant anymore, give them monkeys, the people in my position, They call it complex. The word they keep saying is complex because that means we haven't got any funding. Well, if I had private funding and if the police had done the job to turn up when I got one over years ago and there's 9 witnesses I got, I would have been here. I would have been in private care, a private situation. But no, that's what it's like in this area for years. Unfortunately, if I had my own, I wouldn't be nowhere near it. But sadly, we're doing the best we can, working with these people with their red tape and their blinking statute laws and policies. And excuse me, these are just men and women. It's their management level of public are paying through the nose for, who don't give a shite about ordinary men and women, let alone disabled, vulnerable people in the United Kingdom. They don't give a shite, and I know who they are. I'm not going to mention their names. I'm not here to promote them at all. I just know, trying to be calm, trying to work with these blinking draconian measures unlawfully, and they're what they're doing. And then they're rushing this safeguarding thing the other day. What on earth? I knew exactly what my rights were. So unless you rebut made up assumptions on a presumption, which happened, by the way, without me knowing about this. So good job I had someone to email and make it factually clear of evidence and first-hand knowledge. Otherwise, I wouldn't be here. They would have carted me off somewhere miles away, and that's what their intention was all along. So pure evil, that is. That's working and using my family member to do that, so they cannot have to pay out for what I need to live in a quality of life in the UK. And thousands of people perhaps might be going through this and don't know what I know about their rights. And they hate people that knows their rights. You see, I had this comment in the discharge lounge in part of the hospital, and I got about to go home. They left me deliberately 25 hours for hospital transport, and their computers went down. I didn't get a discharge letter. When that computer system went up, where was my discharge letter I should have had? So I could, had evidence of that. Unfortunately, it was happened. So if anything else happened, and I had a setback, I could have used that to say, I've been here before, and this is what they didn't do a CT scan. I don't know how they should, I don't know. I was too ill to care. I was just really, really poorly. So you're just getting there, getting better. I'm just going to end this now. I need to get rest. But the point is being, this disrepair started it all. On the recent stuff, July to date. The past stuff, there wasn't a disrepair. So you think about it. Why would somebody in a housing company want me to move out of here as soon as I moved in? Yeah? And when I had these OT reports before, minor things to be done in the flat, they wouldn't do it. So if there was a place available that met my needs ages ago, we're talking years ago, I would have done that a long time ago. But I was bidding in the old United Kingdom housing bidding and social housing bidding system. Not one bungalow big enough to meet my needs, the equipment, medical equipment I've got, etc. And it's still like that now to date, even though the system's changed. It's worse, unfortunately. And that's why I've been trying to work with these individuals for my choices and outcomes. And then it's all about the public purse, what part of funding in statute law, they've got a duty of care to make sure I'm not put further at risk. But I don't care. I just live like this. But I don't care. That's only why I'm doing the stream. I'm not about pity me, it's about reality. So that's why they're blinking certain public servants, right? If I'm offered home visits for anything I need, right? They keep making comments about safeguarding. Well, you go back to the bloody public servants already dealing with and tell them then. You tell them what it's like for me to live here, because they ain't take no notice of me. The photos, the emails, the evidence I've come out my years I've done to make sure I get what I need so I don't keep getting ill the bloody time. And then what they do, they twist it around on me. How the hell can I cause all this? Me one-handed in a bloody wheelchair, you know? And that's all they keep saying. And this what gets my mates peed off, because they try and blame it onto my mates. Oh, she's not being cared for, or they're not caring for me right. Go and do one. They do their best. The goodness of a heart, because I got abused by old carers, and I reported them everywhere. The possible lawful due process, the key elements, the key departments you go to. I've done that. Who got held accountable? Nobody. They protect their bloody own. So, unfortunately, we live in a messed up, blinking world. Unless you're face fix, you know people, you might get what you need. And I think you'll find, not just me, thousands of people, maybe more, are going for worse than I. So at the moment, it's a pouring rain, they won't all the windows to let some air in, and charges are cleaning, and I've got to go because I need to finish up, because not a lot of time left. But the fact is, I haven't mentioned anybody who's involved, and who's done what, and who's behind it, the dates or anything, but all that's on a diary, offline, and kept safe for me. And if it happens to me, that will be made public. I'll tell you that now. I have instructions to someone I know privately that will release the evidence. And I promise that will be done. If anyone tries it on again, and the unfortunate things I know about not going to make public, unlawfully, and you don't work honourably with me, then that information will be made public. And I've got a couple of people that, well, I'm not going to say who, but I just put it this way. They know things are not happening lawfully in the correct way. Let's just hope one day, whatever happens, it won't be ideal. And I'm still working with people in the best way I'm able to. But I make sure, hopefully, I think there's no hope about it, I tell you, they will. They have to follow the due processes, and I know what my rights are. So let's get a balance and work together. Will they do that still with the cutbacks? We'll wait to see. But for now, I wish you not going through anything else like I am. And if you are, just going to take a breather and look at things carefully and calmly. It's difficult when you live in like this. But the unlawful breach of duty of care, I know it's been going on about this. You just look at the old videos. At first it was about they just need, it's simple. So you need a grant for disabled facility grant or something, and then you get AT in, and then you do this and do that. No, they definitely want my own skill tender. Well, what about compensation for me then to loss of my own? No, they're covering their tracks to use the adult safeguarding. Well, that hadn't quite worked for them, so now they're going down on this other avenue, where now I just can't go into specific and words what they're saying and how they're doing it until you go for it yourself. Your loved ones or family, you just know how serious the cutbacks and everywhere is affecting so many people. And there needs to be something done. I don't know what the answer is. But I tell you, people like me, if I experience all this and I know what I know, something's going wrong somewhere. And hopefully there's going to be a better outcome eventually. And I could be somewhere safe. It might not be ideal, but it might just meet my needs, and I just hope and figure out on that one. God bless everybody. I just wish to goodness my family had a better attitude. They just look after their own number one kind of thing. It's just not the way I thought my mum would, when she died, they would come together, despite our differences and backgrounds, whatever. But it's not like that. Just a shame, because I thought, build on a better future, you know. Tried to, well, I've always done. But I can't hold out for that. I've got to work on me and concentrate on me and just keep moving on. Progress and the really difficult times. I knew all this would be all difficult. I didn't expect it to be this difficult. But anyway, for those that are struggling out there, and you haven't even got a roof over your head, our prayers are with you. And those are doing their best, by the way. And that's nothing against everybody. It's key people I know about, because there's certain things I can't talk about because I just find out things. It's just pure luck. I find out things, and it's just you can't make it up. It's just disgusting what's going on. And what have I done? No. So if I'd known this area was built on an old railway station and there's nothing solid underneath this drawing that could build a proper secure wet room, I would have never moved in. So I was let this place on false pretenses, and I didn't know that the water seal hadn't been built properly before I moved in. I never knew about all this until last year. Too late then, isn't it? If I'd known all that was underneath the lino flooring, I wouldn't have got them to take it up. I would have made do. But it's too late now. Got to try and move on. God bless, keep safe.